David Eastman is Senior Director of the International Programmes at International Medical Corps, and he joins us now from London. Thanks very much for being with us. What are the priorities right now in Derna?
Right now, it's obviously the cleanup but also the care for the survivors. Our team is in Derna. We met with Ministry of Health there last night. We will be starting health services in an emergency field hospital that they set up a few days ago with our own medical team, but also working with Ministry of Health officials and other healthcare workers there. We're rushing medicines and supplies there tonight to be ready for that.
Are there any healthcare facilities that survived the damage that you can work with there in the city?
The emergency field hospital is right now the best place to start, but there are 2 primary healthcare centers, 2 polyclinics, and 1 general hospital, but none are fully functional at this time.
As of yesterday, yours was the only international organisation allowed inside Derna. Is that still the case?
Red Crescent has been there the entire time, Libyan Red Crescent. There were organizations that were in the area prior to the flooding, but we were the first organizations to enter Derna and be able to start making contact and start being able to inject some support to the people who are already doing the important work.
And how desperately do people need more help from the outside?
They certainly need help in manpower. So the clearing of the dead bodies, the supplies for that, healthcare workers, they are getting donations from around Libya. All of the concerned citizens are sending supplies, but it's the coordination. Cell phone networks are very weak. I'm sure you've tried to do interviews with people inside. Communication's difficult between groups that are responding. And so it's that information sharing and people who to be able to man this response.
30,000 people have been left homeless, maybe more. What are the conditions of their survival at the moment?
Our teams have seen people staying in schools, which obviously is going to have an impact on the start of the new school year. The number is staggering. I mean, there are only 90,000 people in the city. And, the numbers of deaths that are estimated are between 5,000 and up to 11,000. Even if 5,000, that's 1 in 20 people that's died. So the mental stress and trauma on these families is going to be very, very important to treat and continue to care for.
And the WHO is saying that bodies should not be rushed and buried in mass graves, that it's important in the mourning process for people to identify where their loved ones have been buried down the road when it comes to that. But, of course, there's a massive fear that the bodies are decomposing and are contaminating the water. What's your take on that?
It's also very important that the treatment of the bodies is treated with respect, but also that the workers who are doing that are equipped and safe. It's obviously hazardous to be carrying bodies and be working with them. So enabling them to do it safely is also a priority so that we can do it in a respectful and quick manner, but also protect the health of the survivors. And
just lastly, the UN is calling for a sea corridor for relief and evacuations if it comes to that. There is talk of evacuating Derna. Do you think that's a viable thing to create, a sea humanitarian corridor?
I don't have an opinion about that. Currently, there are survivors who need care inside the city now, and that's our priority at this time.
OK. David Eastman, we wish you very best of luck with the important work that you're doing there in Derna. Thanks for taking the time to speak to us on Al Jazeera.